Hey guys, this is Aisha. Today we are discussing about the general neuroanatomy. We are starting with the neural tube and we are talking about the neural tube of the more cranial part. Neural tube further gives rise to primary brain vesicles. These are prosencephalon, mesencephalon and rhombencephalon. In prosencephalon we see there are some vesicles which are seen and they further divide and gives rise to secondary brain vesicle. The prosencephalon gives rise to telencephalon and diencephalon, and mesencephalon gives rise to mesencephalon itself. It will not further divide, it will remain constant. Then rhombencephalon divided into two parts, metencephalon and myelencephalon. So we have three primary brain vesicles. These are prosen, mesen and rhomben, and we have telen, dien, mesen, meten, myelin secondary brain vesicles. So let's discuss about the derivatives of secondary brain vesicle. From the telencephalon, you are seeing that it is more above part. You are seeing that it is looking like cerebrum or it is uppermost part. So we can understand it by this way that telencephalon gives rise to cerebrum or the basal ganglia part, the corpus striatum part. Telencephalon gives rise to cerebrum and corpus striatum. Diencephalon, it is more downward and inside. It will gives rise to all the thalamic part, all the thalamic connections like metathalamus, epithalamus, subthalamus, hypothalamus, and two other things like optic stalk and neurohypophysis. Optic stalk means optic nerve and retina, and the neurohypophysis, which means the posterior pituitary, also derived from diencephalon. Mesencephalon, metencephalon and myelencephalon, these are the secondary brain vesicles, gives rise to midbrain, pons and medulla sequentially. That means the mesencephalon gives rise to midbrain, metencephalon gives rise to pons and myelin medulla. So look at that part. The telencephalon gives rise to cerebrum and corpus striatum. Cavity of the telencephalon gives rise to lateral ventricle. I'll discuss with you the point that the cavity of the telencephalon gives rise to lateral ventricle. Why? Because lateral ventricle is present inside the cerebrum, and cerebrum is derived from the telencephalon. That means the cavity of the telencephalon will always gives rise to the lateral ventricle. Just the same way, diencephalon, the thalamus are derived from the diencephalon, and third ventricle is present in between the thalamus, both two thalamus. That means the cavity of the diencephalon gives rise to the third ventricle. The same way, where the fourth ventricle is present? Fourth ventricle is present between the cerebellum and brainstem. That means the pons and cerebellum. Pons and cerebellum both are derived from metencephalon, and in between them we have fourth ventricle. That means the cavity of the metencephalon will give rise to fourth ventricle. You are looking at fourth ventricle. Then we have myelencephalon, already discussed that mesen, meten and myelin. Mesen derived into midbrain, meten pons and myelin medulla. Then we have aqueduct of Sylvius, that is connection between the third and the fourth ventricle, that is derived from mesencephalon. So at last we will discuss again the point. Telencephalon gives rise to cerebrum and corpus tritum, that are uppermost part. Cavity of the telencephalon gives rise to lateral ventricle. Diencephalon gives rise to all the thalamus, hypothalamus, metathalamus, epithalamus, subthalamus, all the thalamic connection of the brain. Optic stalk gives rise to, optic stalk means optic nerve and retina. Neurohypophysis, that is posterior pituitary. The cavity of the diencephalon gives rise to third ventricle, and mesencephalon gives rise to midbrain, meten pons and cerebellum, myelin medulla oblongata. So that is clear. Now we are talking about the blood-brain barrier. So we are talking about the blood-brain barrier. So we are seeing the, or we are knowing that the component of the blood-brain barrier, the main component, we all listened that we have astrocyte, which are the component which are seeing in this picture, the green color, the processes of astrocytes, which are the component of the blood-brain barrier. But it is not the only component. It is not the main component. It is the component. It is one of the component of blood-brain barrier. Others are, you are seeing that the red capillary, and we are seeing inside, these are the epithelium. You are seeing the basement membrane outside the capillary, and you are seeing the tight junction in between the epithelium of the endothelium of the capillary. So first component of blood-brain barrier is processes of astrocyte. Second is the basement membrane of the capillary endothelium, and third is the tight junction, also called as zona occludens. It is the major, it is important, or it is, you can say that it is a true component of the blood-brain barrier. We know that many areas are devoid of blood-brain barriers, and these areas or these organs are called as circumventricular organs. So why some areas are devoid of blood-brain barrier? Some drugs are act on the part where there is no blood-brain barrier. So we are seeing the areas devoid of blood-brain barrier, and these are the area which is present at the circumference of the ventricles, like lateral ventricle circumference, third and fourth ventricle circumference. We have 6 areas, and we should remember the name of these areas. First one is area postrema, second median eminence, pineal gland, neurohypophysis, subfornical organs, and organum vasculosum lamina terminalis, OVLT. We should remember the names of the circumventricular organs devoid of blood-brain barrier. Why it is important? Because certain drugs are designed in the way that they act on this part of the brain. Now we are discussing about arachnoid matter and subarachnoid system. You know that we have already we know that we have pia mater, dura mater, and arachnoid matter. Dura matter, we have 2 layers: the endosteal layer of dura and the meningeal layer of dura, and in between it we have dural venous sinus, and you know that we have subarachnoid layer also, and the below the part of the subarachnoid layer we have subarachnoid space. And also you know that pia mater is a most faithful layer of the brain, which is always adherent to the sulci and gyri of the brain, and it is not like it is every time it is going inside the gyri sulci, coming out, going in. It is a very faithful layer, but we should discuss today about the dural venous sinus, because pia mater we already discussed. Pia mater is inside, just touching to the brain. After that we have arachnoid mater, and today we are discussing about the arachnoid mater and subarachnoid spaces and subarachnoid cisterns. So this is the part you are seeing, that endosteal layer of dura, and this is meningeal layer of dura, which is going inside the brain, inside the sulci and gyri. You are seeing the dural venous sinus, and this red color finger like projection you are seeing, this is the arachnoid villi. Arachnoid villi, arachnoid mater is this layer is arachnoid mater, and every villi work is to absorb the CSF into the dural venous sinus. That means it is not absorbing the CSF, which is just pouring its CSF component into the dural venous sinus. So you know that CSF is already there in the subarachnoid spaces, and blood vessels, major blood vessels is present, and the main thing which is contained by the subarachnoid space is CSF, which is showing in the green color, and the blood vessels. There are major blood vessels like vertebral artery, basilar artery, major brain arteries, the circle of Willis, everything. So you are seeing the finger-like projection, arachnoid villi. What happens with the age? Arachnoid villi is converted into the old, it is going to be old and clustered arachnoid villi. So its work is not changed, its work is already the absorption of pouring the component of the CSF into the dural venous sinus, but this time it's these villi are old and clustered. The work is not changed, just we should remember that arachnoid granulation is present along the superior sagittal sinus. That means there is more absorption of the CSF in the along the superior sagittal sinus, and maximum absorption of the, that means the maximum absorption of the CSF along the superior sagittal sinus. And most common site of the arachnoid meningioma, not the normal meningioma, it is arachnoidal meningioma. The most common site for the arachnoid meningioma is the superior sagittal sinus, the seeing. So we already discussed that subarachnoid spaces are present with they are taking responsibilities of the blood vessels of the brain, and they have the CSF. Basically pia mater is adherent to the brain, but subarachnoid spaces are not like that. They are large at some spaces, like they are larger than the normal at some places, and this place where the area is comparatively larger in the subarachnoid spaces, that is called as subarachnoid cisterns. So we should know the names of the cisterns. And the contents of the cisterns is very important. You know that in subarachnoid spaces we have CSF is always CSF is though already there in every part in the subarachnoid space, but in the cistern what is more important to learn, that is blood vessels. Which blood vessels is there in the subarachnoid cisterns? So first subarachnoid cistern is cisterna magna, that is the largest cistern. Second is superior cistern, the quadrigeminal cistern, pontine cistern, interpeduncular cistern, cisterna ambiens, and sylvian cistern. Cisterna magna is present, foramina magnum, so that is cisterna magna is the largest cistern which is present. Will show that this is the foramen magnum, and this is cisterna magna, just near to associated with the foramen magnum. That is why it is called as cisterna magna. I will discuss with you later. Firstly, cisterna magna is the largest cistern. Superior cistern, I will tell you why it is called as superior cistern, why it is called as quadrigeminal cistern. Corpora quadrigemina, that is the part of the midbrain that is just near to the superior cistern. Quadrigeminal cistern or the superior cistern is behind the midbrain. Pontine cistern is in front of the pons. Interpeduncular cistern is in front of the midbrain. Cisterna ambiens is on the side of the midbrain, and sylvian cistern is present on the sylvian sulcus. So look at this picture. I want you to anticipate this picture because we'll cut the section of the brain from the corpus callosum, and corpus callosum is white metal bundle connecting the two cerebral hemisphere. So you are seeing this is the corpus callosum. Just below the corpus callosum we have diencephalon. This is the diencephalon, and you are seeing this is the cross section. And look at this part, that the black line which is just adherent to the brain part, which is not leaving any space, that is the pia mater, that is the most faithful layer of the brain. And the red part, the red line, it is showing the subarachnoid space. Just between the black line and the red line, this is the subarachnoid space. And some spaces are larger than the normal. CSF though already there in every part of the subarachnoid space, but this part, the yellow part, all the yellow part, these are the cisterns which is larger than the normal. So look at this. The cistern which is present in front of the midbrain, you are seeing this is interpeduncular cistern. Just behind the midbrain, that is superior or quadrigeminal cistern. Why it is called as quadrigeminal? Because we have corpora quadrigemina on the midbrain. Superior colliculi and inferior colliculi are present on the midbrain. Behind the colliculi, this cistern is present. That is why we are calling it the quadrigeminal cistern. Then see, between the cisterna magna associated with the foramen magnum, that is why it is called as cisterna magna. And cerebellomedullary cistern, why it is called as cerebellomedullary cistern? Because it is associated with the cerebellum and medulla. So we are seeing the mid-sagittal section of the brain. So listen that what is the component of cisterna magna or cerebellomedullary cistern? You know that two vertebral artery combine to form the basilar artery. So vertebral artery enter from here and going crossing from here and connecting to the another vertebral artery of the other side and form the basilar artery from here, here. And the content of the cisterna magna is the vertebral artery, and the one branch of vertebral artery which is going and supplying the cerebellum, that is pica, PICA, the posterior inferior cerebellar artery. These are two arteries contain of the cisterna magna, that is vertebral artery and pica. Then discuss about the pons. तो that यहाँ से जो आर्टरी आ रही थी, vertebral artery, combine here and form the basilar artery here. That means the content of the pons, pontine cistern or cisterna pontis, is the basilar artery. Now, what is the content of the interpeduncular cistern and the quadrigeminal cistern? So, what is the component of the superior or quadrigeminal cistern? So, you are seeing the superior colliculus and inferior colliculus of the midbrain facing the cistern. That is why this is called as the quadrigeminal cistern, because it is behind the colliculi, both the colliculi. These are four colliculi, that is called corpora quadrigemina. That means they are quadrigeminal cistern. So what is the content? You are seeing the blue line in the cistern, in the yellow cistern, which is the name of the vein which is present in the cistern is vein of Galen, also called as, the other name is great cerebral vein. And this is the vein which face going posteriorly, and it will form the straight sinus, and further they will drain again into the portal system. So interpeduncular cistern. Interpeduncular cistern, you are seeing that midbrain is the, you are seeing that in the pons we have cistern in front of the pons. We have cistern associated with the cisterna magna, and this is the only midbrain has cisterns in front, that is interpeduncular cistern, behind the the superior cistern, and side way, on the side we have also cistern on the midbrain, that is this ambiens, cisterna ambiens. So we'll discuss in the another picture. Look at this picture. This is the cross section of the midbrain. You are seeing the superior colliculus in this picture, superior colliculus, and these are the peduncle. You are seeing this one is cerebral peduncle, both are 1 and 2. These both are the cerebral peduncle. So this is the cross section of the midbrain. So why we are calling it the cerebral peduncle? Cistern behind the the superior cistern, and side way, on the side we have also cistern on the midbrain, that is this ambiens, cisterna ambiens. So we'll discuss in the another picture. Look at this picture. This is the cross section of the midbrain. You are seeing the superior colliculus in this picture, superior colliculus, and these are the peduncle. You are seeing this one is cerebral peduncle, both are 1 and 2. These both are the cerebral peduncle. So this is the cross section of the midbrain. So why we are calling it the cerebral peduncle? Because the cerebrum, the tract from the cerebrum are passing from this part of the midbrain. That is why they are called as cerebral peduncle. The corticonuclear tract and the corticospinal tract, they are passing from this part. So this part, this yellow part, you are seeing that this is the behind part of midbrain, and behind the midbrain, which cistern is present behind the midbrain? This is the quadrigeminal cistern. In front of the midbrain we have what? We have interpeduncular cistern between two peduncles, interpeduncular cisterns, and sideways two cisterns. You are seeing the sideways cistern is called as cisterna ambiens. So we already know the vein which is present in the quadrigeminal cistern, that is vein of vein of Galen, also called as great cerebral vein. And these vein is formed by the two veins coming from the cisterna ambiens. This is the basal vein of Rosenthal coming from both the cisterna ambiens and combine and form the quadrigeminal cisterns vein, that is vein of Galen, or the great cerebral vein. This section at the level of midbrain, we are seeing it. So we have seen that the midbrain is surrounded by the cistern on all sides. So one cistern which is left is Sylvian cistern, which is present along the Sylvian sulcus or lateral sulcus, and the artery which is present in the sulcus, the content of this cistern is middle cerebellar artery. And so in this picture we have discussed the content of this part, the quadrigeminal cistern, that is vein of Galen. This part, the cisterna ambiens, the content is basal vein of Rosenthal, but we have not seen the content of the interpeduncular cistern, that is posterior part of the circle of Willis. The interpeduncular cistern content is the posterior part of the circle of Willis, that is posterior cerebral artery or posterior communicating artery. So listen, see this part. So we have this basilar artery dividing into posterior cerebral artery and posterior communicating artery, content of the interpeduncular cistern. So that is all about the general neuroanatomy, about the blood-brain barrier, the neural tube, the dura mater, subarachnoid mater, cisterns, subarachnoid spaces, and everything. So guys, we'll meet in the next video of the neuroanatomy. We'll be discuss about the spinal cord, internal and external features. So if you like the video, please subscribe and share with your friends who need help.